Long-term, older patients is our target population. Many elderly patients have comorbidities that further compromise their health status, which increases the complexity of care that they need. Our intervention is enhanced nutrition by regular intake of essential vitamins, minerals, and increased calories and proteins in the diet. We compare this to current practices that tend to lack emphasis on nutritional health of patients.
Wound-specific diets are important because as nurses, we must always provide holistic care, healing the mind, body, and soul of our patients. We are the forefront of what goes into the patient's body, whether it be medications, food, or vascular access devices. We should be purposeful in what we allow our patients to consume. This is important for patients because improper wound healing can have an effect on health outcomes, hospital stay, financial burdens, and healthcare needs. A proper wound healing diet can optimize healing, infection control, and scar reduction. A healthy and balanced diet can be a powerful tool when dealing with wound healing. Nutrition is something that is easy to get overlooked when it is compared to factors such as medication, hygiene, and hand washing, and skin moisture. In addition, UCMC cares for an array of ages from adolescents to elderly adults. Our geriatric population is increasing as we age, and our wound healing abilities delay. Impaired wound healing in the elderly is a major clinical and economic problem. Wound healing is a large issue for our older population, so we need to be equipped with not only the correct medications, but nutritional tools to treat the issue.
When we were searching for our articles that pertain to our PICO question, there are certain guidelines or parameters that we wanted to fall under. All of our articles were either found in CINAHL or PubMed. We wanted the articles to be between 7 to 10 years old. The population needed to be over 50 years of age, and the patients had to have a wound. A lot of them were actually ulcers. For us to translate it properly, the article needed to be in English, and when searching, we used specific terms such as wound, nutritional supplement, diet, wound healing, and nutrition in hospitals, which then we found our articles related to it.
Our EBP group looked at a variety of article types of varying strength and quality. We took a look at a literature review, a research article, and a few experimental studies. Although our articles differed in quality and strength, the setting and populations involved were consistent, as we saw the population included surgical patients with varying degrees of malnutrition in conjunction with wounds, and the studies often took place in hospitals, not only in the U.S., but South America, in addition to home studies.
Our 6 evidence sources ranged almost all the levels but maintain a good quality B rating throughout. In addition to good quality, the sources all identified the need for altered diets to improve wound healing. The sources showed 0 conflicts between them, which shows consistent, actionable results.
There are 8 types of diets located on the regular menu: regular, sodium restricted, low cholesterol, consistent carb, renal, GI soft, clear liquids, and full liquids. There are also 3 extra menus dedicated to gluten, carbs, and pureed foods. Findings from evidence suggest the incorporation of nutritional therapy is crucial with wound healing. The research evidence also recommended many improvements to current practice regarding nutrition and supplements, calories, and protein. However, current practice provides large amounts of nutrient-dense options such as beans, mushrooms, berries, and greens. What is not included in current practice is the emphasis of consuming nutrient-dense options purposefully to advance wound healing.
Based on our evidence synthesis, we recommend a pilot change in order to further investigate. This program would include a thorough nutritional assessment, implementation of a high-calorie, high-protein diet, which includes an arginine supplement, all while maintaining an accurate food diary to promote patient compliance.
All these recommendations provide the body with enough nutrients and energy levels to expedite wound healing. Specifically, arginine, which is an amino acid that acts as a vasodilator. This increases blood flow to wound sites, which can improve healing time. Arginine can be found in foods like turkey, pork, chicken, pumpkin seeds, and dairy. We can implement this into current practice by encouraging interdisciplinary communication between nurses, dietitians, and food services. We can encourage nurse-patient education and nurse-family education on the importance of diet in regards to their wound, and the food diaries will not only further educate patients, but also familiarize them with the nutrients in everyday foods, enabling them to choose healthy options in the future.
After extensively researching our topic, we found that a wound-specific diet is recommended for better outcomes. We believe the implementation of a wound-specific diet is possible through interdisciplinary teamwork and will make a tremendous impact on the wound patient population.